Namaskar and welcome to Startup Champions. I'm Shubhendu Ghosh. This is the stage that celebrates the startup talent of India. Let's talk about health. The COVID pandemic. It has caused widespread destruction across the world. We all know about that, but on a hindsight, it has also made us more conscious about hygiene and health needs. Aren't we having more conversations about the needs of public health? Now imagine COVID is just one of the numerous health challenges facing the humanity. Here, startups can play a crucial role in bringing innovative solutions to traditional problems. In fact, startups who are joining us today are not only bridging the gaps in our health sector, but they're also bringing in technology to make health, to make healing possible for the masses, and importantly, at an affordable cost. Very happy to welcome the startups who are joining us in the show today. First up, we have with us Nuramai Health Analytics. Dr. Geeta Manjunath, founder, is joining us. Warm welcome, Dr. Geeta.
Thank you very much, Mr. Ghosh.
Can we have an applause for all the startups who are joining us today? And second up, Innovation Medical Devices. Madhukar is joining us from the startup. And let me inform, all our startups are from Bengaluru today. And the third startup, Boniu Life Sciences. Vishal Kataria, founder, is joining us. Vishal, warm welcome to you. And a round of applause to all the startups. And also a round of applause for you, our young audience. So always a very special part of the program. Entrepreneurs of tomorrow, thank you very much for joining in and welcome. And now, let me tell you about our mentor and mentors. In fact, we are hoping to connect with two very special mentors today. But first up, we are joining Ashwin Raghuraman. Ashwin Raghuraman is the founding partner at Bharat Innovation Fund. Warm welcome to you, Ashwin. Thanks very much for joining us today in this program. And at different points in time, we'll be connecting with you to learn about your reflections on the journey of the startups who are joining us today.
Thank you.
All right, and as we begin, coming back to the pandemic again, let's take a look at the manner in which India looked at the pandemic, the crisis, as an opportunity to move towards the path of self-reliance. The manner in which technology and innovation was put to use, and also how it is an exciting time for startups in the country to join the health sector. Let's take a look.
The COVID pandemic has shaken the entire world. Even developed countries were caught unprepared for the onslaught of the deadly pandemic. India's health sector had an unprecedented challenge at hand, protecting 130 crore population against a rapidly spreading infection.
अगर 2020 हेल्थ चैलेंजेस का साल था, तो 2021 हेल्थ सॉल्यूशन का साल होने वाला है। 2021 में विश्व स्वास्थ्य को लेकर और ज्यादा जागरूक होकर समाधानों की तरफ बढ़ेगा। भारत फ्यूचर ऑफ हेल्थ और हेल्थ ऑफ फ्यूचर दोनों में ही सबसे महत्वपूर्ण रोल निभाने जा रहा है। जहां दुनिया को कॉम्पिटेंट मेडिकल प्रोफेशनल्स भी मिलेंगे, उनका सेवा भाव भी मिलेगा। यहां दुनिया को मास इम्यूनाइजेशन का एक्सपीरियंस भी मिलेगा और एक्सपर्टाइज भी मिलेगी। यहां दुनिया को हेल्थ सॉल्यूशंस और टेक्नोलॉजी को इंटीग्रेट करने वाले स्टार्टअप्स और स्टार्टअप इकोसिस्टम भी मिलेगा। ये स्टार्टअप्स हेल्थ केयर को एक्सेसिबल भी बना रहे हैं और हेल्थ आउटकम्स को इंप्रूव भी कर रहे हैं।
India saw an opportunity to transform amidst the crisis of the pandemic. India emerged as the leading manufacturer and exporter of masks and PPE kits. The country also upgraded its capacity to manufacture ventilators. 2 made in India COVID vaccines are ready for the nation and the world. Today, world's largest vaccination drive is underway in India. The budget presented on 1st February provides a much-needed boost to health, nutrition, sanitation and pollution control, all of which will contribute to improved health and well-being. Government to spend Rs 2,23,846 crore on health in 2021-22, a 137% increase in allocation to health sector from last year. A critical care centre to be set up in every block, 17 health emergency centres to be opened in the country, greater focus on mobile hospitals, health and wellness centres will be opened in villages and cities, investment of Rs 50,000 crore in National Research Foundation. Also to help India's startups amid the COVID-19 pandemic, tax holidays for these businesses have been extended by a year till March 31st, 2022. While the pandemic was raging, startups mitigated the challenge with disruptive tech like telemedicine, online pharmacy, artificial intelligence and data analytics. Today, many startups are working alongside the government to fill the gaps in the health sector. With greater focus on health services, the best time for startups in the sector is now.
India converting a crisis into an opportunity. And as I say, best time for startups is now. Let us connect with our mentor to get some initial thoughts on the theme that we are looking at, the health sector. Ashwin, if we can have you on the mentor wall. Now, there's so much focus, attention on the health sector, also given the pandemic that we are all living through. How do you see it as an opportune moment for startups to come in and make a point?
Absolutely. You called it out right? The sector has just come into serious focus as far as startups are concerned over the last 1 year, and this is a permanent change. Startups in general have been evolving in India, and over the last decade or so, the startup activity has increased so much. But specific to healthcare, what has happened in the last 1 year is really going to change the normal. And it's not just the pandemic, there are a couple of other initiatives that are being taken up through either Ayushman Bharat or even other government programs, which are really going to give a fillip to the opportunity space that a startup can address now when they think about even India as a market.
Absolutely. And stay connected with us, Ashwin, as we engage with you further in the program as well. Let's talk about our first startup now, Nuramai. Now, as per a report, but first up, importantly, 4th February was World Cancer Day. And according to a report, the number of cancer cases in India are likely to rise by 20%, by 13 lakhs in 2020 to over 15 lakhs by the year 2025. Now, what is important is that this increase in cases can be checked by timely diagnosis, and even cures are possible amongst all the cancers that exist. Breast cancer in particular is a big challenge for India, and timely diagnosis could be a matter of life and death. But when we talk about breast cancer, even the diagnosis could be a traumatic process for the mind and body of the concerned woman. But one startup is changing that. This is the story of Nuramai.
It's completely curable. Nobody needs to die of breast cancer. But still, we're losing 90,000 women to this.
A tragedy that led to creation. A moment of grief that instilled inspiration in this entrepreneur, Manjunath, who lost 2 of her cousins to breast cancer and is today helping save lives.
Actually, I'm a computer scientist, an accidental entrepreneur, I should say, because I was a lab director at a multinational research organization till 2016. And one of my cousin sisters, Bharti, got detected with breast cancer. She was around 40 years of age. We were very close, and it was very shocking for me.
The loss of a dear one was the catalyst that created Nuramai. A startup that offers easy and portable breast cancer screening solution. With just a small, handy and portable solution like this, Nuramai, this startup is bringing together hardware, software, artificial intelligence and women health on the same platform and helping detect the largest cause of cancer deaths in women, that is breast cancer, because early detection is the key to survival. Nuramai's solution works for women of all ages for early and accurate breast cancer screening, enabling medical practitioners to detect breast cancer at an earlier stage than traditional methods or self-examination.
The technology that we have developed called Thermalytics is a combination of advanced thermal imaging and machine learning. And this technology is very unique. We've got multiple patents internationally as well. And this is not just limited to breast cancer. This can be used for several other type of cancers, other type of abnormalities in the body.
For radiologists, this is the advantage in two aspects. One is it will detect and give us the where is the lesion is there. One. Second one, sometimes there won't be any lesion, but still we'll suspect if there is any hot points or that. So majority of them, they will come with a pain. And if mammogram or ultrasound shows normal, but thermography can detect the site of pain. And other thing is, this is especially useful for large populations, especially when you go out for a campaign where you can do 50 to 100 scans in a day.
With a very strong team of women on ground, Nuramai with its thermography-based solution is creating awareness amongst women in urban as well as rural areas with regular camps, where a thermal device is placed at 3 feet in front of the person capturing thermal images.
We are the only Indian startup listed on the top 100 AI startups in the world. Nuramai puts India on the AI, artificial intelligence world map.
Nuramai has employed a young and enthusiastic team of skilled professionals and also aims at catering nano entrepreneurs at ground level to take the solution to masses.
So we have screened over 33,000 women so far in camps, in rural areas, in corporate camps, in hospitals, in home screening recently, and in buses as well. And women really love our solution. We have found more than 1,000 women who have had cancer or early cancer or pre-cancer, and the doctors are very happy because mammography is not usable on women under 45 years of age.
With artificial intelligence, thermalytics and IT, this healthcare startup has broken limitations of screening in the healthcare sector, promoting breast cancer awareness in women across all ages, making screening accessible, affordable and efficient with its innovative initiative.
Nuramai. And we are at a very important point in our program. Renowned cardiac surgeon, health entrepreneur, Dr. Devi Prasad Shetty is now joining us. Dr. Shetty, what a wonderful opportunity to have you here on this program for startups. Thank you very much for joining in, sir.
Thank you.
Sir, we've been talking about, sir, we've been talking about the pandemic, the post-pandemic world, the health challenges that have come in. But from you first, sir, we'd like to have a perspective on the significance of startups in health sector as you see them. You're also known for your innovations in the health sector. Tell us about how significant you think startups are today.
First of all, every big multi-billion-dollar multinational company at some point of time was a startup. It would have started in a garage or in a shed, just the dream and passion of one or two people who joined together and worked for a mission. And in the end, it becomes a great, great company. So we didn't really have a culture of innovation and starting startups to the level like what it is in the Western countries. But with the government promoting startup culture very aggressively, also the entrepreneurs, the philanthropists and the investors betting on them has made the startup world real in India. Now, if you really want to transform a sector like health sector, the only option we have is to encourage startups to work in an environment of the hospital, constantly interacting with the doctors, nurses, technicians, understanding our pain points, understanding the pain points of the patients, and come up with an affordable, safe solution.
Right. Dr. Shetty, also we know you as someone who revolutionized healthcare in the country in making the best healthcare facility available at affordable, at the lowest cost possible. On that front, sir, how significant does low cost but high quality healthcare continues to remain relevant in the country?
It's the cost of healthcare is not just an Indian problem. It is a global problem. Global healthcare and wellness industry is the largest industry in the world, much bigger than the food industry, which is $8 trillion. Healthcare industry is over $8.2 trillion. It's a massive industry. But the sad thing is, after spending $8.2 trillion, not more than 20% of the world's population has access to secondary, tertiary quality healthcare. Nearly 80% of the world's population do not have access to advanced cancer treatment or a cardiac procedure. Something is dramatically wrong with the way healthcare is delivered today. It has to change. Healthcare has to become safer. Healthcare has to become affordable and also accessible. In India, where healthcare is available only in big cities, for any of the major intervention, in spite of we having so many hospitals, say oncology, how many cancer hospitals are there in India? So we need to really come up with a different model of delivering healthcare, and that can only happen by the startups.
Absolutely, sir. And you mentioned cancer. I'm happy to share that very bright, brilliant, awarded startups are present in the studio and they're watching you as we speak. In fact, I'll encourage them to just reach out to you, the questions that they want to ask and points that they want to raise. If we can start with you, Dr. Manjunath.
Sure. Hello, sir. I'm Geeta from Nuramai, where we have developed a new method of detecting breast cancer. And we have done many camps as well in rural areas where we can make a health worker triage whether a lady requires to be brought to a hospital or not. I'm a huge fan of you and your vision to make this possible in India, sir. So my question to you, sir, is given that there is a new initiative this year for preventive and wellness centers in rural areas, what would be the best way to reach out? And because government is the route to actually reach out millions of women in India. So your advice on how we should get started and how do we make this happen on the ground, given that we have actually done many trials with cancer societies and NGOs, sir?
See, the scaling up is the biggest challenge, which you have to see what is the model of scaling up. Now, once you have the validation from the authorities and the various regulatory bodies and the medical commission say that, yes, we trust the report coming from the your gadget, which I'm sure it has already established.
Yes, sir.
Now, it is a matter of scaling up. The scaling up by tying up with various hospitals, and hospitals will not be happy to make a upfront payment and buy your machine.
Okay.
Best thing is to give it to them free of cost, but for every procedure they do, obviously the hospital is charging some amount of money, so you can take a percentage of the hospital fees.
Okay.
That you can decide. That is the easiest way for you to scale up. But if you are going to do that, my suggestion is you have to choose one particular city and try it out first to understand the nuances of all these the modalities, because you shouldn't be in a situation wherein you have borrowed a huge amount of money and you have distributed all over the place, but nobody is using it.
Sure.
Whereas if it is in one city, you will be able to advertise. And when you advertise, patients have the option to go to multiple centers. So essentially, you have done a great job in creating something. Now you should be even more innovative in marketing it and making it a financially successful venture. Otherwise, all your dream and aspiration will just evaporate without really touching the people who need it. In the end, it is not you fail. in the end, desperately poor people who have access to diagnose their cancer at an early stage, you have failed them.
All right, that was Dr. Devi Shetty, renowned cardiac surgeon and entrepreneur. So let's talk about our first startup. Nuramai, Dr. Geeta Manjunath is with us, founder. Dr. Manjunath, we understand that diagnosis is very crucial in any case of any cancer, but for breast cancer in particular. But we also learned how the process of diagnosis in traditional method can be very difficult and painful for women. How is your startup changing that, and how difficult has it been so far?
Yeah, honestly, breast cancer is one of the largest cancer incidences seen, right? You know, recent report says not just in female, overall, you know, if you look at the number of cancer cases, breast cancer is by far the highest number of incidences seen.
In
right?
India?
In India, globally as well, right? In every country, in fact, right? So, the unfortunate thing is that though India contributes only 20% of the incidences in the whole world, we contribute to 50% of the deaths, which means early detection is so critical to save lives, and we are not able to do early detection in India. And the reason for that, like Dr. Shetty mentioned, is multiple: affordability, accessibility. In addition, today's methods you know, are not really suitable for the Indian population, because Indian population is more younger population. For example, mammography, which is a very good test to detect early stage breast cancer, apart from being non-affordable to many, it also doesn't work on what's called as dense breasts who are under 45. And most women, or actually 50% of the women who get breast cancer in India are under 40, under 50. So this is a huge problem. As you also mentioned, the experience of taking a test with mammography is also slightly, you know, uncomfortable, I would say, because 10 kgs of weight is upright. So what we do is, instead of using X-rays, we just measure the temperature variations on the chest using a very simple thermal sensor. And because of this, the test can be completely no contact, you know, no touch, no see, as we say.
And that's the device, Dr.
Yes,
Manjunath,
this
if
is
you
the
could show
device.
to us.
This is a very simple device, which is, many of you would have seen this in COVID screening and so on, right? The thermal sensor. That's what this is. This is a much more high resolution. It's like a thermometer, but it can give 4 lakh temperature points per person. So we actually keep this in front of the device and control this remotely. And so we just have a booth. The lady enters into the booth. She takes about you know, 2 minutes of imaging. That's all is needed. 10 minutes of cooling, and that's it. Nobody would have seen her. Nobody would have touched her. Her report can be ready. So it's as simple as that, thanks to thermal imaging and artificial intelligence-based software that Nuramai has developed.
Truly transformative health solutions. At this point in time, let's also connect with our mentor. Ashwin continues to be with us. Ashwin, thank you for your patience. Transformative health solution by Nuramai. How do you see their journey and also the solution that they're providing?
Yeah, Shubhendu, I've been seeing the Nuramai journey over the past few years as it has evolved from a distance, and it's amazing how they've progressed over time, right? You know, it's very interesting. A lot of healthcare startups, and this is a good example, Nuramai has actually been born out of a personal experience that the entrepreneur had, and kudos to Geeta to have the courage to say, I leave a very cushy job, well-paying job in a large MNC, and then say, I will create a startup that will solve a real problem which is there, both on the affordability side as well as just, you know, solving a big healthcare problem. In India, there's 1 in 30 women who are at risk of breast cancer. And if you look at the Indian population of 1 billion, and assuming this is about, you know, close to 45% are women, you're really trying to solve a huge problem that exists in India. And I do think that Nuramai should really start thinking now, given that they've reached so far, as to how they can address a significant percentage of this problem. The second piece that I see their journey evolving into is also, I think Geeta alluded to that, how well can they start addressing a global problem as well? Because the minute you've got an affordable device, the concept of reverse innovation kicks in, which is build in India, make in India for the world, and the ability to create affordable devices is a lot more in India simply because you only have a certain amount of paying capacity here. But once you've created it, your solution becomes applicable globally. So that's the other interesting market that I think Nuramai will start looking at if they already have it.
Right there, Ashwin. Thank you very much for your thoughts. Also, Dr. Manjunath, Dr. Kiran Majumdar-Shaw of Biocon also had something special to share about your startup. Let's listen in.
Of course, in the past, there was always a fear factor associated with breast checkups because of how painful mammograms were. But today we have a new solution which is being provided by a very exciting young startup called Nirmal, who actually have come up with a thermoprofiling technology which actually creates a heat map of tissue and thereby detects the smallest of lesions in breast cancer. And this, I think, is a very exciting time because these are non-intrusive and painless kind of interventions for breast screening. And I encourage every young girl over the age of 25 to start doing annual checkups using these kind of technologies. I think Nuramai has a huge potential because I think breast screening and annual breast checkups are going to be very important going forward. So anyone over the age of 25 ought to go and get a breast checkup done using a Nuramai breast checkup technology.
The wonderful words of encouragement there by Dr. Majumdar and also transformative startup there, Dr. Manjunath. Let's move on to our second startup now. We're talking about Innovation Medical Devices. It's a startup that believes that speech, spoken word, is not a privilege, it's a right. They are working towards creating technology for voice restoration for patients of throat cancers who undergo surgery, and they developed a own voice prosthetic that we'll learn about. Let's take a look at their fascinating journey.
Speech as a right, not as a privilege. God created a universe in which they gave us a voice box for free for everybody when we were all born.
Silence can be scary, especially for the people who lose their voice to throat cancer. Life turned upside down 13 years ago for Sudhidra, an engineer and businessman in Bangalore, when he was detected with throat cancer. The thought of not being able to speak crossed his mind every now and then. With several devices in the market, he tried speaking, but not with much clarity, and had already spent a lot on devices until 2016, when Dr. Vishal implanted his innovative low-cost device to help him speak with greater clarity.
So I have been using this process from the last 1.5 years. There was no change. But still I feel very, very glad that I can converse very clearly.
The motivation for us came from that one single patient who was a security guard who couldn't speak. He had lost his voice box and lost his job. And my core thought was, can I bring back his voice and get him back his job?
Moving ahead to solve the issue, Dr. Vishal set up Innovation, a medical device company, in 2016, and along with co-founder Shashank Mahesh, and built the Om Voice Prosthesis, which is the mold of the voice box prosthetics made out of silicone, an affordable device which enables throat cancer patients who have lost their voice box to speak again.
This is a simple 1 centimeter device that weighs 1 gram, and we have about 7 patents on this, all innovative and thought-provoking. Simply what this device does is it fits into your throat and it converts your food pipe into a voice box. It basically cheats the brain to convert the food pipe as though the food pipe is behaving like a voice box. And through this we are able to speak again.
Several patients have got the device implanted and are currently able to speak. Many of them have got their voice back after several years.
One of them, which I can fondly recollect, was a politician from Tamil Nadu, gone into severe depression at several bouts, and he even attempted to end his life thinking that he'll never be able to speak again. We fitted the voice box for him and he spoke, I think he spoke continuously with me for about 15 minutes in Tamil, which I didn't understand. But the joy and the love that he showered on us to say thank you for giving his voice was for me something very special.
You should see the first expression the patient makes when they hear their own voice. You know, we have had patients who have not spoken for 15 years.
The device comes with an assistive kit and many beneficiaries have got it implanted under the Ayushman Bharat scheme.
I'm happy to say that with these innovations, we have more than 500 plus patients speaking across the world, and we've taken it to nearly 9 countries now.
With the mantra of speech is a right and not privilege, this startup is changing lives by offering something that is invaluable yet extremely precious: a voice.
5, 6, 7, 8, 9, 10.
It's a brilliant journey of innovation medical devices. And Madhukar, founder, is with us. Madhukar, great to have you with us. Great to see your journey. I'm very curious. You're also carrying the device for us to see.
We've made a small little innovation where we've embedded the device into the visiting card.
How small it is?
It's just about a centimeter. I can pull it out for you. There you go. That's the device.
This is amazing, and such a small device, but so transformative.
Absolutely.
Bringing back a voice of a person.
Yes.
Madhukar, I'm really curious to ask, how do you feel the first time a person is able to thank you in his or her own voice when you put that device into them?
So, like Dr. Vishal mentioned in the video, the first patient was a security guard. He hadn't spoken for close to 5 years, and primarily because of expensive devices available, he was not in a position to pay for them and come back to treatment. And he was advised to live without a voice and be happy with the fact that he's recovered from cancer. But that is something that disturbed Dr. Vishal very, very much. And that is what drove him, along with Shashank, our co-founder, to come up with the solution, reverse engineered, made in India, to help these patients speak again. This device is a very, very simple prosthetic device made out of a very high grade platinum cured medical grade silicon, which when implanted connects the food pipe to the air pipe and thereby makes the food pipe vibrate, which produces the voice. And the first time this patient came to us and had the voice box fitted and spoke, he was in tears. And that is what made us realize that this is what we should be doing. Innovate for a single patient, and the markets and masses will follow.
And Madhukar, you say you innovate for the masses. How much does it cost? If you can give us a comparison of how much does another form of such voice prosthetic cost?
You have available devices, imported ones, which cost anywhere between 35 to about 55,000 rupees. And currently our solution is available in the market at 8,000 rupees. But that's not the only approach for the market. We have a few approaches as far as pricing is concerned. So we've looked at the Ayushman Bharat model, under which a patient from the weaker sections of the society is available, is in a position to pick up this device absolutely free of cost. The government funds the whole device and the treatment to him. Then you also have a model where you have patients who don't essentially come under the Ayushman Bharat scheme, but also are in a position where they cannot afford expensive treatments. And when I say expensive, they were not in a position to even afford the 8,000 rupees that we charge for the device. So for such patients, we have a foundation which is connected to the company called the Om Foundation. The Om Foundation is raising funds, and through that we enable and support these patients by giving out these devices free of cost. That's the second model. And then we have a commercial model where patients who are in a position to buy these devices from us pick it up from or go to private hospitals, the best of surgeons, and get themselves this device once again.
Dr. Shetty, if I can now introduce the second startup who's joining us. Innovation is with us, Madhukar is with us. What they do is they create voice prosthetics, particularly useful for people who've undergone throat cancer treatments to get their voice back. Madhukar, founder, is with us. Madhukar, what would you like to ask our mentor?
Good afternoon, Dr. Shetty. It's an absolute pleasure to have you on the show, and I've been a big fan of the kind of work that you've been doing.
Thank you.
Being a startup from Bangalore with limited resources, and the point that you mentioned of startups having to focus on being coming out with solutions which are affordable and accessible. We, in fact, at Innovation follow that mantra of making our device, the Om Voice prosthesis, an affordable, affable and accessible solution. But we've managed to make the device affordable, We've managed to make it simple enough for people to use, the surgeons to insert the device, but accessibility to the market has been a big challenge for us. So how do you think a startup with limited resources like ours would be able to address that issue?
See, the first thing is the market. Market for you is very small because the clients who need your support are not very large.
Absolutely.
But good thing is, in a few days, you will get to know the number of doctors who will be able to utilize it. So you have to zero down on the doctors who are in that area, specializing, who may be your clients to use this device. Right. So once you do that, then you have to really choose 5 or 10 of them and invest on them as how do they, because in the end, no patient will come to you directly.
Correct.
They have to go to the doctors. So somehow you have to rope them in to be your supporter and a sponsorer. Once you have done it successfully, then it will be easy, because doctors generally look at the precedents. If you have tied up with few doctors in one city and they have been successful, doctors are happy, you're happy, then it will catch up very fast. The biggest problem I find with the startup, they all get distracted very fast. This is the biggest problem, because after some time you see the next opportunity and you start jumping into that. So this is the mistake what most of the startups do. Unless your first product is successful and financially viable to start, pay for all your dreams and aspirations, you go from one to the other, in the end you will not succeed, because irrespective of the usefulness, society is very, very slow to embrace technology.
Let's also get some thoughts from our mentor who continues to be with us. Ashwin Raghuraman is with us. Ashwin, we just saw the story of innovation, not just transformative innovation changing lives, but also affordable as compared to other technologies and options available. How crucial is that factor for Indian startups in the health sector?
Let me first start by saying what a lovely name, what an innovative name itself, Innovation, right? And just listening to what Madhukar was saying, Indian patients look at doctors as gods, right, traditionally. And I'm sure anybody who's got his voice back looks at Madhukar like he's a god now, and I can just only imagine the feeling that he must be getting when a patient gets his voice back. Your question is very important. See, the data says that the per capita spend in India on medical devices is roughly $5. The global average is $50 per capita. And in the US, that's $500. And therefore, the purchasing power for devices like these, which are very important for you to even sustain any level of quality of life, is extremely important. And Madhukar has therefore been able to deliver to a patient population which can only afford something and then deliver a quality of life. I do think that apart from the fact that you are uplifting patients who have not been able to afford devices, there are other aspects of it which are also how profitable you are, right, when you're delivering it at that cost. And I'm sure that Madhukar and team Innovation have been able to innovate affordably using technology and not just by bringing down quality. And I think that's the crux of affordable innovation and extremely important for a nation like India.
Great there, Ashwin. Thank you for your thoughts. Please do stay connected. Let's now talk about our third startup, Boniu Life Sciences. It's a nutrition supplements company. Now, they're revolutionizing the manner in which nutrition is carried into the human body. We are familiar with syrups for nutrition. We are familiar with tablets for nutrition. But have you thought of a thin strip that quickly dissolves in the mouth when you put it? Let's look at the fascinating journey of Boniu.
The world of medicine or drug administration has evolved with time. From concoctions to tiny tablet, capsules, injections, topicals and whatnot. Defying traditional methods, a startup called Boniu in Bengaluru, started by a brother and sister team, is introducing a new way to take your daily dose of nutrition and medicines by oral dissolvable thin films. If I tell you that a small strip like this can give you the nutrition of having a glass or more than a glass of turmeric milk, or a small strip like this can give you the experience of having green tea, then it will come as a surprise for you. But a startup called Boniu Life Sciences is changing the way people consume medicines and is bringing a phenomena in the sector of nutraceuticals.
We thought of coming up with a format which is not only highly palatable but very, very effective compared to tablet or a capsule that is available in the market. My expertise for that matter has been in the process engineering side in the pharmaceutical industry. Bhavna had worked in the management side in the pharmaceutical industry. So we both thought of setting up a small R&D unit.
With a credible team of scientists, engineers, nutritionists working to bring simplification, ease of use and healthy living, Boniu has created a wide array of solutions. The product line comprises of mouth-dissolving strips, topical application strips, gummies and shots for various supplement needs with natural ingredients in most of them.
When we are developing a product, the first step will be like, will I consume this if I am a customer? We have 3 categories: oral, topical and dental. So in oral, we have different multivitamins and we have curcumin immunity boosters, and then we have this herbal extract strips. And when it comes to topical, we have glutathione patches, acne patches and anti-aging patches. And dental category, we have teeth whitening, teeth sensitivity. So we have 3 wide categories of range.
The films are usually designed to dissolve after contacting the tongue within seconds with no need for water, making ingestion easy for children. Improving effectiveness and ease of use, Boniu is creating its space in the market of nutraceuticals.
We've always seen our supplements coming in the form of tablets or pills, which then it does become an issue, especially with children and elderly people. The kind of products they've got, especially the films, is much easier for kids because it's more palatable. It has better absorption. It can be taken on the go, so you don't have chances of missing it. You don't have to have water to be able to consume it, and you enjoy the taste.
Potential investors are also looking at Boniu's wide range of products in the market with expectations.
We got our first angel investment from the US market.
Just open the foil packaging, retrieve the thin film and place it on the tongue to dissolve. This new way of taking medicines has started upstaging tablets, injections and much more. Boniu has opened up another yet a better way to get your daily dose of health.
It's a brilliant journey of Boniu Life Sciences, and Vishal, founder, is with us. Vishal, did you have a lot of bitter medicines as a child? Where did this idea come to you?
I think you're right. We thought, and we always had it in our mind, that medicines have to be swallowed or they are always bitter in taste. So you need a glass of water. You don't enjoy the medicine because the doctor has told you you have to take the medicine. Given a choice, you would like that a medicine is not only palatable, but it should be very, very effective also. So what you see on a Boniu platform in the form of a thin film, there's a lot of technology behind it. When I say technology behind it, it's not only about the palatability, it's about the absorption also. So when it comes down to the thin films, these are only second best to the injections that are available in the market.
You mean in terms of absorption?
In terms
and you're
of
also carrying those strips for us
why
to
not?
see.
I show you one of our vitamin D thin films.
Wonderful.
Yeah. So let me just take it out for you. So these are very, very thin films which can deliver very high dosages.
And it's safer for individuals to ingest?
Absolutely safe.
Right, right.
You just put it on the tongue and this gives you close to 2000 IU of vitamin D on your tongue itself.
Wow. That's
but
amazing.
The beauty of it is that it gets absorbed into the blood rather than going into the stomach, then getting metabolized and then getting absorbed in the blood, which takes 30 to 45 minutes. But in case of thin films, it just happens within 5 minutes, which basically means the onset of the drug or the active happens within 5 minutes. So it's not only about the palatability, but also about the effectiveness compared to any other delivery.
Right. Dr. Shetty, that also brings us to the third startup who's joining us today, Boniu Life Sciences. They are into nutrition supplements work and development. What they've done is, we can be, we may not like to take tablets or injections all the time as far as nutrition related inputs are concerned, but they've developed a thin strip that dissolves in the mouth when you put it. So that's the innovation that they've come up with. And Vishal, the founder, is here with us. Vishal, what would you like to ask our mentor?
Thank you so much, Sunando. You are a role model, sir, for everybody, I believe. So thank you so much for giving us the time. My question to you is, Boniu Life Sciences has developed oral thin, mouth-dissolving oral thin films as a delivery platform for delivery of any kind of drugs, nutraceuticals, or any other actives that can be incorporated in this particular platform. And this platform has much more advantages compared to a tablet, capsule, or a syrup to take the drugs. And very few of the innovations have happened, especially in the delivery system formats globally. We are the proud patent holders of this particular innovation, sir. But we want to take your guidance as well as your experience on how do we scale up this kind of a delivery system, especially in the healthcare sector, to deliver drugs to the pediatric or the geriatric populations.
I mean, I'm not an expert in this area, but my suggestion after hearing your story, my suggestion is first you should look at pediatric population as your clientele initially, because they're the ones who are reluctant to chew the tablet, take the tablet. Now, after you have identified a particular product which you think may be the right medication or the food supplement which children have to take, because children have to take a lot of nutritional supplements as well. So after you decided on one medicine, then you have to identify the company which is making it, and you have to work with them closely, because I guess without their cooperation you may not be able to market it. And if the company becomes your partner, then your job is done, because they have hundreds of marketing people who will go around the countryside trying to sell your product. I think you should really look at one of the pharmaceutical companies to partner with you.
So let's turn to our mentor. Ashwin continues to be with us. Ashwin, nutritional supplements are reality of the modern times, but the manner in which Boniu has given a distinct identity, what kind of an advantage does it give to them in this particular sector of nutritional supplements?
Yeah, I think the whole wellness segment is exploding, right? In terms of just there being so much more awareness that is emerging, the shift from health to wellness as a means to good health. And so the convenience of this delivery mechanism is obvious. And I was just thinking to myself, there are some of us who keep traveling, we lead hectic lives now. And just to be able to take a small thin film from your pocket when you're on the road, when you're in a cab, and just pop it into your mouth, whether it's a green tea type of a supplement that you're adding, just the convenience of it is fantastic. And I think that's one advantage. But I was a lot more interested in hearing something else that they mentioned, which is the efficacy is higher as well.
Absolutely.
And supplements in general have been known, their absorption levels have been known to be low through various studies that have been conducted. And to therefore come with a delivery mechanism where the absorption level of a supplement that you are taking is improved, I think gives them a big advantage, not just in India, but globally as well.
The road ahead, how do you see it, the engagement between the traditional health sector, health structure, and the startups? Do you see more engagements happening in the coming future, the necessity of it? How do you see it panning out, sir?
The advice I have for all the startups, doctors are very, very difficult to work with, because when you come up with an idea that this is what you want to do, we will as doctors tell you exactly what we want. And you know very well as the technical person that the solution, how it should be done may not be the right, that is not the best way, you know it. But do not ever tell the doctor that he is wrong. Tell him that, okay, what he is saying is a fantastic idea, let me do it for you. With difficulty, do it the way he wants, the doctor wants, but also show it to him and he will find so many glitches, then you show the real solution what you have in mind. You can politely say that, sir, this works much better than what we thought earlier. And never say the doctor is wrong. You say that we did a mistake, sir, in going in that way, but this is a better solution. And once he uses it, he will love it, and then he is your fan forever.
This is fantastic. Thank you very much for sharing your perspectives, your vision and your wit and humor. Dr. Shetty, always a pleasure connecting with you in our programs. Thanks very much for joining us.
Thank you.
At this point, let me take some quick questions from our audience members who've been sitting very patiently here as well. Quick questions, if you can just raise your hand. Yeah, go on, shoot.
My question was that when we start a business, like we have heard of Jeff Bezos, the founder of Amazon. And he has got 100 failures before the Amazon company. How many failures all of you have faced before this success? And what problems have you faced and how we should come over that problems?
How to overcome failures. I'll take the responses from one of the startups. Dr. Manjunath, if you can share with us your mantra for that.
Sure. So from my side, I was an intrapreneur before becoming an entrepreneur. What that means is within the company, like Hewlett-Packard and Xerox Research, I was a research scientist proposing newer ideas to the business. So I had this cushion of financial, risk, right, that we could afford. So I have worked on more than 30 different ideas, and 6 of them have become some form of product within Hewlett-Packard and Xerox earlier. So, but yeah, 25 others have not become that. And I've also been a lab director, so, mentoring others in the failed and also successful ideas has given me a lot of learning. But
amazing.
It's a very
so success and failure went
question.
hand in hand.
My question is that when you are initial state in your setup, when you discuss your ideas with your family members and closer one, what the reactions they give you?
Okay, what kind of support? Madhukar, if you'd like to answer that one, those initial ideation stage, how was it for you?
So, in the case of innovation medical devices, this was pretty much the idea of Dr. Vishal, but shared with family and friends. And I, being part of Dr. Vishal's extended friend circle, we've had a lot of these discussions on how he wanted to take this forward. Being a health practitioner, a medical practitioner, he understood the healthcare side of things, but a medical business or a healthcare business is about the amalgamation of the business side along with the healthcare delivery, and that is where his friends, family were able to bring in. His wife is a practicing advocate, so she was able to look at all the legal implications of setting up the business and guide. So till today, we have a very, very big involvement of the family that goes hand in hand to help us in our day-to-day business lives.
Okay. Ma'am, as you said that you are working in rural area as well as in urban area, ma'am, do you find difficulty while explaining your concept to rural areas people, especially to the women? Because at a certain point, the people don't talk about sanitary napkins over there. So how are you able to give their message of yours to them?
Yeah. No, actually in rural areas it is much easier to convince them, right? Like Dr. Shetty was talking about, right? First you can try out. I'm not saying we will do bad for the rural people, but when you actually go and say we're going to look at your breast health and tell you whether you're healthy, in fact we have received very, very positive response. One is we don't see or touch the person, so that is good. And also the second is, just like sanitary napkins is a taboo word, breast is also a taboo word. I don't know why, it's just like hand or leg, right? So when we go and talk to them about it, they're so happy. There is somebody who is coming in asking about their problems there. So we have found it very, very helpful. Again, you have to relate to their mindset and talk in their own language. Apart from that, they're very supportive.
Right, and Vishal, if I can just bring a final question to you about support of the family. You and your sister started this venture. So for you, it's like the family really came together like never before. How was it for you?
I think, yeah, family plays a very, very important role. I'll give you an analogy here. It's only family probably who thinks you are the most intelligent. Rest of the people think you are a fool only when you enter into entrepreneurship.
So it's good to bring the family along.
Because they're the only ones who really believe that you can you can do this. And in my particular case, especially in Boniu Life Sciences, when we discussed this idea amongst ourselves, between my sister and myself, both of us were coming from the pharmaceutical industry and had worked for a couple of years, close to 20 years in the pharmaceutical industry itself and at senior levels. So when I told my wife that I want to quit the job and start the business, she was like, are you going to really do anything in your life which is going to be successful, or are you going to keep doing R&D whole of your life itself? So but the family really supported, because this is a very risky business. The success doesn't come so easily here, as you rightly said. How many failures you had? In our case, I think every 6 months at Boniu we would have what we call as a near-death experiences. So near-death experiences would mean that we would be almost at a point where we would be closing the company.
Perseverance and patience would also be a key, Vishal.
Yes.
Great. Thank you for sharing those experiences. And well, that's all the time we had in this edition of Startup Champions. Let me thank all the participants, beginning with our mentor, Ashwin Raghuragavan. Thank you so much for joining us. Your insights are going to be very useful for the startups who are here and the startups entrepreneurs who are watching this program. Thanks very much for being a part of Startup Champions.
Thank you. It was fantastic being here. What a pleasure to listen to all the entrepreneurs.
Great, thank you. And thank you also to our startups, Dr. Manjunath, Madhukar, Vishal. The pleasure hosting you here and learning about your inspiring journey. Thanks very much for joining us. Thank you also to our wonderful audience with excellent questions that you put in the last moment. A round of applause for all of you and all the startups who are present here. And as we come towards the conclusion of the program, we'd like to talk about the kind of impact that Startup Champions is already having. This is vis-a-vis our previous episode. Take a look.
Ever since our last DD Startup Champions episode, I'm very happy to inform that we have partnered with National Skill Development Corporation, and we are conducting mobile robotics skill competition for all the CBSE students from 8th standard to 12th standard pan-India. Any student can come and register on our www.holoeducation.one platform, and the student, their teachers, as well as the schools will be eligible to win exciting awards like these robots that you see. Similarly, we have partnered with Agastya International, an NGO which is working with us to bring these type of mobile robots as well as virtual education to any school near you on their mobile vans as well as on mobile phones through our Holo Education platform. We are also very happy to share that we have received investment from Kitaki, which is a New Zealand-based venture fund, to take and expand this concept internationally.
After the show, we had this fantastic opportunity to meet the mentor on our show, Dr. Shivan, ISRO chairman, and we signed an agreement, of cooperation with ISRO for technical collaboration, and also all the 3 startups on the show, Dhruva, Bellatrix, and Skyroot, we all signed MOUs with each other and started collaborating as suggested by our other mentor, Shri Somnath. So thanks to the DD show for bringing us together and giving this fantastic opportunity.
With that, we conclude this edition of Startup Champions. Tell us about how you're liking the program. If you want to connect with any of our startups, you can write to us at startup.india.gov.in. That's the email, and with that we conclude this program. But this journey of learning, this journey of inspiration will continue. See you in the next episode. We'll take your leave for now. Namaskar.